Screening for transfusion-transmissible infections is critical in blood transfusion services to ensure patient safety. What are the infections that are mandatorily screened for on all blood units in India? In India, every blood unit collected from the donors has to be screened mandatorily for HIV 1 and 2, hepatitis B virus, hepatitis C virus, malaria and syphilis. This video describes the ELISA and rapid testing methods for HIV, HBV and HCV screening, smear tests for malaria screening, RPR test for syphilis screening, HIV, HBV and HCV screening. HIV, HBV and HCV are routinely screened by ELISA tests which detect anti-HIV antibodies, HBV surface antigen and anti-HCV antibodies. ELISA procedure. First, let us list out and describe the equipment, reagents and basic requisites required to perform the ELISA procedure. Equipment: ELISA washer, ELISA reader with printer, incubator, calibrated micropipettes 1 to 10 microliters, 5 to 40 microliters, 40 to 200 microliters, 200 to 1000 microliters, tabletop centrifuge. Consumables: kits for testing anti-HIV antibodies, HBV surface antigens and anti-HCV antibodies, micropipette tips 20 to 200 microliters, 100 to 1000 microliters, gloves, test tube racks, 1% sodium hypochlorite solution, distal water, tissue paper, marker pen. It is important that biosafety precautions be taken before the test is performed. We now proceed to see how the ELISA test is performed. Preliminary measures. Sample identification is done by cross-verifying donated blood unit numbers with corresponding pilot tubes containing serum. Check the reagent kits for lot numbers, expiry date and any visible abnormal changes. Prepare worksheet with particulars such as name of the test, date of testing, reagent lot number and expiry date, name of the technician performing the test, signature of officer in charge, and unfilled columns for entering positive and negative controls, and donor unit numbers in sequence. Always adhere to manufacturer's instructions. Test kits, reagents and samples are brought to room temperature. The donor samples are centrifuged to separate the serum, 3000 rpm for 3 minutes. Test procedure. Prepare wash and buffer solutions according to the manufacturer's instructions. With the help of a micropipette, load the respective wells with the required volume of controls and serum samples with diluent. How do you hold the micropipette during sample loading? A. Horizontal with tips touching the side. B. Vertical with tips not touching the side. Yes, the answer is B, vertical with tips not touching the sides. Hold the micropipette vertically and dispense the samples into the wells. Do not touch the sides of the well to avoid cross-contamination. Make sure that tips are changed after dispensing each and every sample. Discard the tips in a kidney tray containing 1% sodium hypochlorite solution. Then incubate the microplate at temperature and duration as instructed. Now, wash the microplate using ELISA washer as per kit literature. Invert the plate over a tissue paper and dry it by gently tapping. Then add enzyme conjugate and incubate again. Repeat the washing step. Meanwhile, prepare the enzyme substrate and keep it ready. Dry the microplate and add enzyme substrate to the wells as per instructions. Add stop solution to fix the color developed in the wells. Ensure that the blank well is negative. If not, the test is invalid. Results must be read immediately using the ELISA reader. A printout showing the absorbance values for the samples in the microplate is obtained. Interpretation of results. Calculate the cutoff value as per the kit literature. Those which are above the cutoff value are interpreted as positive or reactive. What is the grey zone in the interpretation of OD values in the ELISA test? A. 10 to 20% above cutoff. B. 0 to 10% above cutoff. C. 0 to 10% below cutoff. D. 10 to 20% below cutoff. Yes, the correct answer is C. 0 to 10% below cutoff. Values ranging from 10% below the cutoff absorbance to that of the cutoff value fall under the grey zone. Values below the grey zone are interpreted as negative. Samples in the grey zone have to be retested, and if the cutoff value falls within the grey zone again, or if it is more than the cutoff value, then it is considered positive. Document the results. The printed report of absorbance values and the worksheet should be maintained in separate registers.